Just a little bit about the National Non-Hodgkin Lymphoma Audit, who we are, what we're trying to do, the performance indicators that we're reporting on, and our outputs. NNHLA is one of 10 national cancer audits in NatCam, the National Cancer Audit Collaborating Centre, which is funded by NHS England and Welsh Government. It's been funded so far on a 3-year plus 2-year extension, so we're currently funded until the end of September 2027. And NatCam was set up in October 2022 as a new Centre of Excellence in the Clinical Effectiveness Unit, which is a collaboration between the Royal College of Surgeons of England and London School of Hygiene and Tropical Medicine, which is where we form our clinical methodological partnership. This is the team, and you'll see quite a few of us in the webinar today. Our partners are BSH and the Royal College of Radiologists. We have a clinical reference group, which is chaired by Rupinder Gill, and our charity partners are Lymphoma Action and Blood Cancer UK. We also have a patient and public involvement forum, which is chaired by a patient, Frank Burrows. So the aims of our audit are to provide regular, timely evidence to cancer services of variations in NHL care in England and Wales, to identify reasons for the variation in NHL care and help guide quality improvement initiatives, to stimulate improvements in NHL detection, access to treatment, and outcomes. We report on up to around 10 indicators per audit, and our first reporting began last year when we reported these indicators, whether or not patients were seen by a clinical nurse specialist, whether they were discussed at MDT within 4 weeks of diagnosis, high-grade NHL patients starting chemotherapy within 62 days of referral, high-grade NHL patients starting radiotherapy in 8 weeks at the end of chemotherapy, receipt of radiotherapy, and 2-year and actually also 1-year survival of high-grade NHL patients. We also report survival for subtypes of all subtypes of NHL. And then we have got a further set of indicators that we are developing, and we've added 3 more this year with more to come. So 2 more indicators this year, proportion consented for a clinical trial, first-line chemotherapy treatment regimes for high-grade NHL, and a new contextual measure, the proportion presenting in an emergency. We report annually our State of the Nation report, and the second of those was published this September. That reports on these performance indicators nationally and at individual NHS Trust and Welsh Health Board. And in England, for this year's State of the Nation report, we've been reporting on the year 2022, and for Wales, we've been reporting on the year 2023 because of that's the data available to us for those countries. We also have quarterly data dashboards and a State of the Nation data dashboard, and I'll be showing you how to find those. So the quarterly dashboards, we update those every 3 months for NHS Trusts in England. There is no quarterly reporting for Wales just because there is no rapid cancer data available for Wales. And there's about a 6-month lag in those quarterly dashboards because we're using this rapid cancer registration data. We report on data completeness over time, data completeness snapshots comparing each trust to its peers, and performance indicators over time. Our State of the Nation dashboard, published annually at the same time as the State of the Nation report, and that is for England and for Health Board in Wales. And there's a much longer lag there because we're using the gold cancer registration data. In that dashboard, we report data completeness, snapshots compared to peers, performance indicator, benchmarking compared to peers, and some tumour characteristics. The quarterly data dashboards are particularly relevant for what we're talking about today because we're aiming to use those to drive and monitor local quality improvement, starting with data quality. So to find our dashboards, go to the NatCan website and find data dashboards. Here's what the quarterly dashboards look like. So your performance indicators over time there is a control chart. Data completeness over time with a target of about 90% completeness and data completeness snapshot compared to your peers. So these are interactive dashboards where you're able to select your own trust and compare it to others.